Good morning from London. On behalf of Sadiq International Virtual University, today we have an expert, a mentor, a tutor par excellence, a teacher who has credits beyond my description. I can't really enumerate all the credits that all the attributes he has, but he's one of my oldest colleagues and comrades. It's such a pleasure to have. He's also editor
Thank
of
you,
a
sir.
book publishing global medical education. He's also just been to Barbados and he'll be joining there to improve their quality of medical education in the Caribbean. So lots of things. Shahid, over to you. Bismillah.
Thank you, sir. Thank you, sir. And welcome, everyone. Assalamu alaikum and good evening. In Malaysia, it's 8 p.m. Evening. And first of all, I would like to thank Mubashir and Prof. Zadi and SIVU for inviting me to deliver this talk, which is very pertinent to my practice, as well as is very close to my heart, that the topic, because during the pandemic, if you all remember, we were faced with unprecedented challenges, and those challenges actually compelled us to do research, to do publication and all, and innovate a lot of new models that we had. And all along, when I go and discuss all this, I will be introducing all those, and you can go through, and I'll be giving you the link to, or Hassan is there, he can give the links of those innovative models in assessment and in teaching learning that were innovated to face the constraints and unprecedented challenges of the COVID-19 pandemic. And so is the topic here, that the post-COVID-19 adaptations, application of the lesson plan to task-based learning online in a blended learning environment. And let me tell you that, first of all, we shouldn't let loose what we have in a very compulsive situation, in a very challenging situation of the pandemic, where we all were sort of compelled to go on emergency remote teaching. But gradually we develop our expertise with the technology, and we combine it with the pedagogy. Now, one cannot imagine, even we are face-to-face, even we are on campus, but we can't imagine that any pedagogical or any educational model, be it assessment or evaluation or teaching learning, can be done without the application of technology. So therefore, this is the topic that I'm going to take with you, and this is about the task-based learning. And task-based learning, I would request you to identify it separate or different from the team-based learning. All along, I'll introduce what this task-based learning is, but it's a very good model that you can practice in your clinical education. Online, a version has been created, and all the institutions who want me to support them in developing this for their institution, I'm always available. So let me introduce the topic first, challenges and adaptations. So basically, the COVID pandemic confronted us with the very unprecedented challenges in medical education, particularly in clinical education and assessment. So various adaptations have been made, and they were made effective for teaching learning model in the given constraints. Students' engagement, however, was one of the most challenging tasks for the faculty. How to engage students? When I say engaging students, it's not about those who are active or who are, take lead in interaction, but all the students that are attending, like in a face-to-face or on-campus class, how to engage them would also was one of the, using technology or pedagogy, whatever you do, but we must make sure that all the students attending online are actively involved. But in this given constraint, and in particularly online teaching with the clinical education, the most important role goes to the supervisor or the faculty or the teacher. So I'll be taking you through in the introduction a few slides, maybe 5, 6 slides, where some key post-COVID adaptation, which was found imperative to clinical teaching, has been carried all along after the COVID is over. But as I said, these are something we have to treasure, because these are something very innovative we created, and we should continue delivering it. And I'm lucky that my institution has allowed post-COVID, since the COVID was over, but it's still not over. Still the threat is there. So in such a situations, we were allowed to do initially to move on to face-to-face or on campus. So we started with smaller component face-to-face, but gradually, and now we are doing on campus mostly. But we are also carrying out our online delivery of the various teaching learning methods, and task-based learning is one of those. So continuing with the remote and hybrid learning mode was to minimize the physical interaction and maintain social distancing. When we were this movement control order was lifted, but still a threat is there. Sporadic threat is always there for the cases are reported, and so still we have to take precautions, and this attempt to still continue with remote teaching is one of the options. So continue clinical teaching adapted to various virtual platforms that we use was video conferencing, the telemedicine, and the remote communication tool. Realize the faculty crucial role in facilitating online learning session. And this role, not only for the faculty to develop themselves, personal development has to be there for a faculty, but at the same time to develop students, because the students may be novice to some of the technology. So create visual modes with guided learning using virtual patient environment and a virtual medical clinic. And I'll share with you virtual medical clinic, which we often use in our task-based learning. And even earlier on during the COVID, we have used this on bedside teaching online, which is again a published model. And Hassan perhaps will share it in the chat, and you can download. Going through the integrated technology tools with the pedagogy for the use of technology has become essential for the clinical teaching. You can't move without technology now in your educational delivery or teaching. The faculty must embrace technologies to replace clinical scenarios, and some of those I use are the digital platform, virtual simulation, electronic data, and the record. And I'll talk about the electronic data for the lifelong learning. During the COVID, we were always stuck how to gauge the lifelong learning behavior of the students. Now it's so easy. With the data analytics, we can always see, for example, if I have created after my session, if I have created virtual medical clinic, and I want to see this virtual medical clinic is actually after the clinical education online, the students can go online and can assess themselves. And this data analytics will inform me, if supposing 30 students were in my session, how many of them has visited. So this tells the lifelong behavior of the students. So that's easy now to capture. So faculty must guide students to navigate tools, interpret data, and make decision in analytic reasoning or critical reasoning situation when it arises in clinical education. Adapting to online self-assessment was another aspect of it that we still we developed during, and I'll share with you towards the end when the assessment component comes in this presentation. So this was by modifying the traditional assessment to suit remote hybrid learning environments. And I have shared earlier also, but I'll reshare with you the IRAD, GRAD, and the virtual medical clinics. Assigning faculty to research and innovate various online assessment methods. And those were IRAD, GRAD, integrated OSCE. This is online OSCE. We also call it TOSCE. Task-based integrated OSCE. BEST is online version of the BST. Then open book exam and video-based evaluation such as virtual medical clinic, making it mandatory to provide guideline and feedback to the students. It goes without saying that all teachers must now be open to feedback. Focusing on enhanced faculty students communication is the most daunting task for the online teaching. We must make sure that all the participants, all the students, and most of the time online session are a small group. So one should be able to manage that everybody, every student has been communicating and nobody is passive. So effective communication between faculty and students is vital to clinical education, particularly faculty to practice various communication channels in online clinical education has been going on with almost every faculty, email, contact, instant messaging platform, and discussion boards are to maintain the contact. Faculty to practice virtual office hours and consultation to students' learning need is very important. This we particularly practice during the COVID, that so that the students are not left stranded or frustrated, so they can contact us anytime if they have any issue regarding technology or the pedagogy. Practicing active learning strategies and collaboration to have. So active students engagement is crucial, as I said, particularly online teaching and clinical education. And faculty adapted and implemented to various active skills learning strategies are mandatory, and this has been practiced. A number of these as case discussion, problem solving exercise, and a small group virtual session, instant messaging platforms such as Microsoft Team or Zoom that we are doing now. Using the current our venue is Zoom, and so these are the instant messaging platform. So students actively ensured by analyzing and applying theory to real world scenarios is very important. So when we do clinical education online, task-based learning is one of the example. We chose in our all sessions, we chose the authentic cases. When I say authentic, mean real life patients. So this was possible. Those clinicians who have been keeping a record of and data of their patients in their clinic and maintaining a good archive during this period, 2.5 years of the period of the COVID, I have no dearth of having those cases. So first of all, we give a choice to the students to go online. First choice is to go in the ward and pick up a case, relevant case, according to the theme of the week. If the case is not available, relevant to the theme, then they can go online. And if not online, then they were available, then they will contact the supervisor. So supervisor should produce a paper patient based on a real patient scenario, which I have been doing because of my having kept all those records during my over 25 years of practice of ENT. So I have no doubts of those cases, and I have been comfortably using those cases. And one today, the example I'll be sharing with you. The students' activity ensured by analyzing and applying theory to the real world scenario, as I said, is very important. So choose as far as possible the authentic or the real world cases, I mean the real patients. Healthcare professional collaboration to foster the teamwork and communication is also important and can be done easily when multidisciplinary session can be held online in clinical education, such as the task-based learning. Then allowing flexibility and adaptability to remote teaching learning to ensure that the faculty and the students alike must be adaptable to flexible. This is very important, right? For example, somebody is for some reason is not well to join, or network issue, another issue. A recording can be done, and the students can, and their leisure time, their free time, they can watch through those recording. Because say if they miss out a face-to-face on-campus session in the classroom, there's no way they can get onto the session again. But here online, the beauty of the online, if recording is done, and we mostly do the recording, the students who for reason are not attending can attend it later. COVID-19 has brought unexpected challenges and disruption and we all agree with that. But at the same time, the faculty who has been very keen teachers and who have a knack of having the research and all, they utilize this time and created a lot of new models, which and they because previously prior to the COVID, we all had the responsibility of teaching, learning, and assessing our students. But during the COVID, there were two additional responsibilities for all faculty, and those were, number one, researching from your own area, indigenous research, and then having those published for the global community sharing. So these were two additional responsibilities that was thrust on us during the COVID pandemic. Flexibility be allowed to schedule curricula and teaching methods and IT training, right? And faculty should be open to feedback, I say, for continuing quality improvement in teaching and learning. Because, you can't rely on literature all the time. You have to have your own indigenous research if you want to improve on your teaching, learning, and assessment method. That is very important. I use word indigenous research. This is very important to be guided to improve or evaluate your assessment and teaching learning method based on your learning outcome. And if there is any conflict, their learning outcomes are not achieved, you can always go and recheck and from your own evaluation or research. So let's come to the topic now, the post-COVID adapted model, which is the lesson plan, a lesson plan developed for the task-based learning. Okay. So this lesson plan, previously we were doing all the face-to-face, and we do have a lesson plan, but that was more or less not documented. Now lesson plan has to be documented, and in our all teaching in my institution, and I'm sure the other institution would have been doing the same, 20 to 30% of all the learning material has to be uploaded on a student's portal. So they have to be made available, and I'll share with you during all this while how many videos we have created, because I don't, there are so many of these are available online, but I trust when you develop for the students your own videos, and I'll share some of those, and then you can have a running commentary on those videos and your student as if you are teaching your students. So that is fantastic, and I have a very good feedback that also I'll share towards the end. So the definition about the task-based learning is a teaching approach which focuses on the students by asking them to do the meaningful activities. That's one, right? So this is mind you, this is different from the team-based learning. In team-based learning, you can have a larger class which can be divided into small a number of groups, and these groups actually will be given pre-class assignments and then in-class assignment and GRAT, IRAT for their assessment and all. But this is a model where you ask the students to do a task, and this task is, and they are divided into groups. It's not that you will take the entire class, like TBLs can be even divided into 10 groups, and the entire cohort, the entire class can be taken through the TBL by one supervisor, unlike a PBL. But in task-based learning, actually, you should not have a very big, a large class. Rather, say 30, 40 students can be divided into 3 groups, and the task can be assigned, and then later they will share. And I'll give you the protocol. And the other thing which is important, I would like you to keep in mind that PBL and CBL, case-based learning, and the TBL, team-based learning, are very comprehensive model with a very specific protocol and procedures. You can't deviate from PBL procedures or TBL procedure or CBL, but task-based learning is a model which is not provided with a comprehensive steps or the procedures. So there has been a lot of variation, but over the years, especially during the COVID, when we practice it online, and we realized that we can always create a comprehensive model where the steps and procedure can be designed and developed for all faculty to follow through. And that's we have done, and I'm sharing that with you right now. So the TBL reflects on task performed in a sequential manner, and then it is shared by the rest of the class. Information is released by the presenter in role play. So say we have divided the entire group into 3. One is dealing with the clerking or the history taking examination and investigation. The second group will talk about the management, and third, we'll talk about the epidemiology. This is the breakdown that we normally bring to our sessions, 30, 40 students divided into 3 groups, right? The first group, one of the students, he plays role play as a patient, and he takes all the question online, like we do in clerking. And I'll exactly show you how we do it. Okay, so the role of the students in TBL is very important because this is student center. So students have to, trainees may work individually or in groups, right? We actually practice. Student, there's some disturbance here. Okay, anyway, we practice in divide them into groups, 3 groups usually. So they gather information on tasks given by the teacher or the supervisor. Teacher is in a supervisor role. Is a very slim role in teaching in task-based learning. They can communicate with supervisor, peer or senior colleagues, perform and later bring the task for the entire class discussion, and the students perform in subgroups with tasks assigned to each group, and each group has its we have a theme-based learning outcome, and then each group is also assigned with learning outcome. So the role of the teacher here would be moderator or a facilitator, right? Not a teacher. No spoon feeding. We just have to see the students are right on the track. If they are derailed, we have to bring them in onto the track, right? And we have to guide them, but not spoon feed them. So cooperate, listen, and respond to allocate tasks, give an introduction, tasks, and help the students monitor the activities, create opportunity to involve every student in interactive session, and then keep attentive throughout the session and give feedback. And he's always open to feedback because feedback in task-based learning is very important. And for this, because the session is more student center, we are in the on the back foot and we just observe them doing it. But towards the end, we can create a reflective writing platform from them, and I'll share that also. And when they reflect, and you have to give feedback. It's very important. If you have created a reflective writing or reflective practice for the students to reflect on teaching learning session, then you must give them feedback also. Rationale would be task provides input as well as output, but it is the process which is more important than the outcome. If students end up with the wrong diagnosis also, is not as worrisome as if they do not follow the procedure once you have put the procedure together. So the task implement students centered learning is interactive learning and collaborative learning. You must ensure that everybody communicate, and task drives the motivational activities. You give them a task and they are very, very motivated. And I tell you, in task-based learning online, I don't have to really call them. Once they know that, I take my example, if they know that the theme that we have this week, I am the supervisor, it has never happened that I have contacted the student. They are so enthusiastic, so motivated, having heard from those who have gone through this session or seniors, and they will contact me. Sometime I receive midnight call. They are so motivated and they ask for the how they have to proceed in this, and I'll give you how I share with them the guidelines and all. The task adjust difficulty is very difficult of training pedagogy is important. You should give them a task to the level of their training, not beyond their level. If they are in semester 6 versus semester 10, then you should know what complexity of the patients you should choose for them. Now, quickly talking about the theory applied to the practice. So first principle here is hypothetical deductive approach. The students would be given to start with just the clinical problem. Then they, like in a clinic that we do interview the students, the patients, and then we examine them. And so, and hypothetical deductive to start with, we will have when the patient walks in and I see he talks few words, and I know there could be a multiple conditions that I may be suspecting. So a big differential diagnosis to start with. But as the information keep coming and hypothetical deductive approach is applied, I can slim down the or narrow down the diagnosis. Thinking aloud approach, the entire group will think aloud. This is where the communication is ensured that everybody is participating. They can have their chat open and they can use their mic, and we allow them to use their mic one by one, and they talk and we monitor them that everybody is participating. The third thing is the experiential learning approach is adopted. And as you know, the 6 steps in experiential learning approach is the authentic patients, which means real patient is a context. Reading from the book, one can read from the book any disease, any conditions, but I tell you, the retention, because every information that we pass on to the student, it goes to their short-term memory. From the short-term memory, it must be brought to the long-term memory, because students, you see, they are bubbling with knowledge when they are very close to examination. Even some of them have more updated knowledge than the teacher or the examiner. But 7 to 10 days, I tell you, 7 to 10 days after, the way they learn would wipe off from their memory. So if it is retained in the short-term memory, to bring information to the long-term memory, we need interface or reflective practice. We do reflective practice or the interface. Interface is provided by the experiential learning. What it means, not reading from the book. If a student is in the clinical years, must go to the ward and read from the patient. Okay. And what does it mean? Authentic patient is the context, first principle in experiential learning. So I think the second principle is brainstorming of the prior knowledge. Like in BST, we allow the student to pick up a patient and clerk a patient, and then we say, okay, when you have finished clerking, then give me a call, I'll come and I take the session in a small group. So when they are clerking, I'm not standing on their head and telling them do this way or do that way. I just let them alone, and this is the brainstorming and test of their prior knowledge. After having clerk, they develop an experience, is a step 3 in experiential learning, right? So they develop an experience, and when they present, is their reflection, is steps 4. And 5 would be the feedback provided by the supervisor. And I always engage peer also to give feedback to their colleague who's presenting. Okay. So this is a step 5, feedback. And then through that feedback, a student presenting would identify gaps in knowledge. So they, in task-based learning, and the lesson plan that we produced here and we upload on the portal, we tell them that everybody has to participate and identify the gaps in knowledge. So we are also working, all this while we have worked on their metacognitive skills as well. So let me introduce this very important, because Bloom's taxonomy has been about the cognitive domain. Now Anderson has modified it to inculcate the knowledge domain. And the knowledge domain that we must ensure, and this COVID period, I have realized that working alone with the cognitive domain is not adequate. You have to work with their knowledge domain. And knowledge domains are the factual knowledge, procedural knowledge, and declarative knowledge, and metacognitive knowledge. So the factual knowledge is somebody, say you are, leave alone the medical student, anybody, a plumber or someone, wants to do a task or want to deliver, he must have some basics knowledge. This is called factual knowledge, right? And then procedural knowledge. So factual knowledge is there that he must have certain instruments to work with, and then how he has to work with these instruments is the procedural knowledge. So I give him a task to say, any task I give it to plumber, he will, with factual knowledge and the procedural knowledge, he will be able to do it. But I give him a very complex task, right? So this complex task will be done by his declarative knowledge. What is that? Declarative knowledge is factual knowledge and procedural knowledge put together with the metacognitive skills that I know. If say I'm a student, I have been asked certain skills to perform. If I do not have factual knowledge and procedural knowledge, my metacognitive skills or metacognitive knowledge will tell me that I can't do this or I can't perform this task. And if I have these two knowledge and my supervisor give me a task, I successfully do that task, then to give me higher marks, for example, he want to test me for more complex tasks, he will give me complex tasks. Then my metacognitive skill will tell me I have factual knowledge, I have procedural knowledge. So this current situation demand me for the declarative knowledge, meaning how would I use these two knowledge to do a complex task, is performed by your metacognitive skill. So what is metacognitive skill? It is thinking about your own thinking. Very simple. Use this, remember this word, two words, thinking about your own thinking, knowing about your own knowledge. Now, this has become very important for the student to be taught. And another research project that we had is in publication now, is accepted for publication, metacognitive skills. I think next month, EIMJ will publish it, and I'll be able to share through SIView platform. Okay. This is all about the experiential learning. This is the Coles model. Experiential learning has been developed by Coles. So is about experiencing. Experiencing must have the context, real world context, or real patient, authentic patient, and prior knowledge. Then experience is developed with that. Then somebody present or reflect. Then feedback is given. He can use this, identify gaps in knowledge, and can plan his way to read more and or learn more to develop his declarative knowledge to do complex cases. Now, the principle of the team-based learning here is the TBL approach basically seeks learners' engagement. That's the first thing. So in task-based learning, we divide them into small groups to engage everyone. Contextualized learning, patient, right? And as I say, authentic patient. Performing with interactive group work is important. And then TBL aims at a series of authentic tasks achieved. So prioritizing their prior knowledge. So we know what level of training they are. So if they are in the earlier year of the clinical phase, then we might be emphasizing more on interviewing skills, communication skills, and the other would be, yeah, there was some noise, I got distracted. Okay, so interviewing earlier phase, clinical phase, we should focus on interviewing or communication skill, history taking, examination, and further on, maybe in semester 7, 8, 9, maybe management and more complex cases. So we have to prioritize that, acquire new knowledge and experience as we move on with task-based learning. So task-based learning is facilitated by teacher in supervisor role, right? Monitor students' performance by giving feedback and share personal experiences towards the end. So students may present, but a good supervisor in task-based learning must be prepared with that topic, because I normally do not want students to tell me the diagnosis of the case that they are going to discuss in task-based learning, because I want to actually be with the students and solve this problem, like as if I am in a sitting in my clinic and a patient has come. But if I am given the diagnosis by the students, so that point of time, I don't enjoy delivering in task-based learning. But if I have to share in my debriefing session, then I have to go back to the topic, and from my archive, I have to dig out or curate some of those cases. For that reason, sometime I tell them, give me what is the patient you are discussing. But most of the time, I prefer not to know about the diagnosis, so that I can work together with the students. Practical approach, intended for problem solving is, as I said, Barrow's hypothetical deductive process. Cass's interactive process of hypothesis testing. Hypothesis testing means that you say assume a number of the diagnosis, differential diagnosis, but what is the ultimate diagnosis or working diagnosis that you will be testing your hypothesis or differential diagnosis. And this is done to speak aloud, using a speak aloud, meaning that the entire group is allowed to work together at the same time. This is the infographic, and here I can share with you the test of the prior knowledge is tested, experience, reflection, then Gibbs model for reflection, and the course model for the experiential cycle. And if you can see, I can take you along in TBL. We start with the history, and then we do the examination, investigation, and ultimately the management. Okay. Now, the principle and design here, what happens now, I'm taking you to the actual procedure in task-based learning. We have the theme, like in ENT, we have 12 themes. We work during the posting. We have to have one task-based learning for each theme. I'm taking here, the theme is neck swelling. Okay, so what we do is we will put down for the task-based learning, you have to have your learning outcome. Learning outcome for that particular theme for neck swelling. So what students need to learn, and mind you, the learning outcome is different from the learning objective. We were taught through the learning objective. The teacher would come in the class and he would deliver the lecture, irrespective whether we learn or not, was not that much concern of the teacher, right? But under the learning outcome, we are bound to take the responsibility that whatever we deliver, the student should be able to practice or do it after I leave the session. So learning outcome is about a student be able to perform or do after this they have attended the session. So neck swelling, about neck swelling, the learning outcome is developed. Then we divide them into 3 groups. Okay, so first group will be dealing with the clerking, history taking, examination, differential diagnosis, and investigation. Second group task would be the management, right? They will talk about the management, and third group will work on epidemiology, learning outcome. I tell you, this is a very good format I'm giving you. Practice this. It covers everything for the student from semester 6 to semester 10 in clinical phase. So first group do the clerking, and then you give maximum time to them. Second group we will, and if you are doing undergraduate, the outline of the management should be focused on. For postgraduate, more detail. And then epidemiology is must, right? And my students are doing fantastically well when they work on epidemiology. Actually, they are adding to my knowledge because we often ignore this. So my grouping is one group will handle the epidemiology. Okay, so design of the TBL, this is a way of syllabus delivery or implementation. Pedagogical task is given to students to do some task, then authentic task is selected, meaning the real patient, and task-based learning is the clinical competencies are identified and grouped into as many categories as you want, depending on the competencies, but I generally divide them into 3. So, and you will not find much article or much, if you browse through the task-based learning, you will find a lot of article for the team-based learning, but hardly for the task-based learning. So I'm trying to give you the detail about this. So it is the task-based learning anatomy would be pre-task, and then a task focus, and the task cycle. So this makes together 3 steps will make together the task-based learning. So for the pre-task, we design the learning outcome. The supervisor will ask the students. The students leader will approach you, and through him, you will send out the guideline and everything. And the students divided into 2 groups will be done by, but before that, you have to pick up a patient. So first preference, as I said, is from the ward. Second, if not in the ward available patient as per the theme of the week, then we go online. If not available, a student will contact you, and then you have to, if you have your own archive, rich archive, then you can share from there. Otherwise, you can create a paper patient based on mock situation. So learning outcome is the first thing you must decide about the theme, which is neck swelling, and then learning outcome you will also decide for each of the subgroups. But then you also send this guideline to the students that they are divided into 3 groups, and then 20 minutes maybe for the if 1 hour session, 20 minutes will be given to the group clerking, involved in clerking or history taking, examination, investigation. Another group will give in less time, maybe 10 minutes each for management and the epidemiology, right? And then we have in class, we also have assessment, self-assessment, which is online. They can do as individual and then as a group. I'll share you in a moment also. Then these links are provided through the group leader, right? So these link, if I go through, I'll later in in the interest of the time. So these are how we pass these on to the students, right? And this students, a group leader will then further send out this to the entire group members. These are the links. You have to develop all these, and I will do. Let me come to that point when I will share how these. I'll open this link and show you. So the background of remote clinical teaching is that during the COVID, we have worked hard, we have researched, we have published, and we have treasured a lot of new models. We shouldn't let them lose. We shouldn't let them go wasted, because COVID-like challenging situation can come anytime in future, and our faculty should be tuned up. Our students should be acclimatized with online learning. Therefore, it's a good idea to have, if not all, 100% face-to-face. Please continue doing at least 20 to 30% your delivery of the curriculum online. So this is basically during the COVID that we have. And then the reason why we came up all this model is many authors relying on demand resource theory have been helped to hypothesize the issues of constraints of clinical teaching. Initially, assessment and clinical teaching was abandoned by many centers, many medical institutions during the COVID. But later on, as the research came up and people contributed, the clinical education and the assessment was carried out even during the COVID. So these are some of the articles. The first is the bedside teaching online. Then we have some other TOSCI. The task integrated OSCE was online OSCE. And we have some other emergency remote teaching publications that were all you can download when you have recording. These are these QR code is given for all these articles. You can download and read. So these are the bedside teaching model is the applied is the same as the task-based learning I have discussed with you in the infographic on the left side. And here you can see down there is the TOSCI, the task integrated OSCE online. So we use one patient, say the same patient, we give clinical problem to the students and online, and then he worked through it. Then in the another, we will present in a breakout room in the Zoom, we will present the patient to them, and this simulated patient with some examination. So you have to come a level low. You see the Miller's pyramid. In Miller pyramid, in actual situation, when you have physical contact, you can ask the students to examine a patient. So that is show how level, right? In Miller's pyramid. But you have to have a level low in TOSCI online, because we ask them to explain. For example, how would you examine this patient or some simulated patient sitting there in another room? They can't touch, but they can look at it and we say, okay, examine. How would you do the knee jerk so they can demonstrate on their own knee and using a hammer and all. So it's or this is if they use hammer on them, or is a demonstration, show how. But in TOSCI, we have level low is knowledge and knows how level. So we ask them to explain how would you do certain tasks of the procedure. So, and the same patient is taken from the history to examination, investigation, and management. From room to room, the students will moving. But the topic is, we call it integrated and task-oriented, because it is unlike OSCE station, which is segmented. In real life situation, we have a segmented OSCE. One is from one area, surgery, medicine, and all. Here we use the same patient for integrated, and it's more close to the long cases, which still is considered, and people have been revisiting for the clinical test long cases. So I think TOSCI online is a good option, but in the constraint of unprecedented challenge like COVID, if it happens again, or some other epidemic comes in, we can always be ready with these models. So here I take you. So here you see, I'm taking an example of the ENT. My area is head and neck and thyroid. So I'm a head and neck thyroid surgeon. So I will have these. So among these, sore throat, hoarseness, and all, my area is sore throat, hoarseness, and neck mass. Okay. Then the other faculty, two other faculty will be doing other. So learning outcome is defined in ENT, task-based learning. Then we have the TBL online student will be able. So we give the first thing we have to post them and send out the learning outcome, right? So the learning outcome is sent out, and some a PowerPoint we send out them for test of their prior knowledge as well. So we start here. So students will be role playing. The first group will have a representative patient. He role plays, and he is now, this is a girl, 13-year-old girl, come with a swelling on the right side of the lower jaw for 1 month. Just the clinical problem, nothing else, right? So clinical problem, and no pathological entities or any further information is given. Then we ask the student, what do you want to know from the history? And then everybody will chip in, use their mic, switch on their mic, and then they can contribute, or they can use chat box. Okay, so they are using chat box and they are using mics, and then they will say these are the questions would be asked from the patient role playing, from the student role playing of patient, this particular patient. So these are some of the questions. I just, for an example, I have put down here, and then from the chat box I picked up, and then they will go until they are exhausted. So once they are exhausted, a complete history of this patient will be provided to the entire 3 groups, which is around 30 or 35 students. So the patient data and the patient's complete history is provided, but after they have exhausted from their question, interviewing the patient, which is presented to them online. Okay, now after this, they will be asked about the differential diagnosis. So we do this practice after every clinical attribute. They will be asked to do the differential diagnosis, exactly the way a clinician will work up with the patient. So these are the differential diagnosis proposed by the students. Then we ask them, what examination would you like to perform? And then students again will propose some of those examination, and supervisor will be guiding them if they are missing out something. So with the open-ended question, not the closed-ended question, with the open-ended question, you can guide them if they are missing some of those examinations. So for example, they have put down chat box, or using their mic, they have asked that they will be examining a neck examination for the mass, and for lymph node, oral cavity, oropharynx, and bimanual examination for major salivary gland. So next would be what examination would you like to perform? And then they will be given the actual examination report, right? So here neck examination is provided to them, examination of the oral. But mind you, after they have done this exercise on their own, then we provide them the next step, the exact examination finding. Then we ask them to review their differential diagnosis, because more information has come. This is called hypothetico-deductive approach, right? And speak aloud. So they all will be contributing together, and but of course taking their turns. Differential diagnosis will be reviewed, and in this case, based on the information given on examination, they ended up with 2 branchial cysts and the pleomorphic adenoma in this particular case. All were then slashed off because of the information provided. This is a hypothetico-deductive approach. So what investigation would you like to order is the investigation part. They will then again go on, and they will give us what investigation they intend to do. Supervisor role is, if they are missing out some important investigation with open-ended questions, he will bring them to the task. So ultrasound, FNAC, CT, full blood count, Montus were some of those suggested. Then after having done that, we give them the exact investigation finding. In this case, ultrasonography was shown to them, and lab investigation about Montus, the normal blood count, and all FNSC and all. And I prefer because these are in my archive, so it was easy for me to put down and share with the first group, which is dealing with the the students, the patient's history and examination investigation. Then later on, the exact investigation findings are showed to them, and the CT scan, if or any I tell you, it's I prefer either from the supervisor archive you pick up the case, or from online. Online, tell them to pick up a case with the complete investigative and examination finding reports available, because in ward we do not allow them to have an access to the folder or to the investigations. So sometimes I prefer, I actually I desire them not to have a case, but ideally we will to be as close as to the authentic learning. We first ask them to pick up a case from the ward, but case from the ward, they may not have all these findings to show to the entire class. So end of the day, the working diagnosis, pleomorphic adenoma also was slashed off, and bronchial cyst, right? Then debriefing will start, and this is not mandatory. If supervisor is ready, otherwise he can verbally talk. So if I'm ready, say I shared this, because bronchial cyst was, I remember I have 37 cases in my archive, so I can pick up any one case anytime that I can share with my students. So the congenital epithelial cyst and everything. So this is the patient, this is the cyst removed, this is the CT scan, and this is the operative procedure. Sometime I have a small video, but at the level of the training, if say in senior class, there I'll share some of those edited video of the procedure. Okay, so this is the procedure shown. Then some of those differential that they couldn't think of would be shared by the supervisor. So some of those new differential they missed out can be added on. Now the students, how students contact us is just WhatsApp messages. You see, the group leader has contacted me on a certain day and time, and asking how to go about this session. They asking me that I have a session with them on neck swelling, and you see, so this is my chat. Then I will immediately say, okay, I'm sending you the guideline of the neck lumps, right? And this guideline actually will you have to share with the rest of the every student in 3 groups. So this guideline will be provided, and if I can open this, so I click here, so I open, so a student can also open this here. Yeah, okay. So the team-based learning theme, neck lump. This is the session objective learning outcome, and these are the specific learning outcome to neck mass. And then there are time allocation is also in this guideline is given to them. Then the students will be divided into 3 groups. One is dealing with the history, examination, differential diagnosis, and their learning outcome is put down here. The management group learning outcome is here, and the epidemiology group learning outcome is here. So they work through guided learning outcome, okay? And then prior knowledge test, also some of the videos. For example, I have created this link examination neck lump. I'll send them to them. I say, before you come to the session tomorrow, watch through this. So for example, this is a video which I created during my COVID period with the help of the e-learning department. They were very cooperative during that period. So this is, for example.
Good day, everyone. I'm Professor Shahid Asad.
Can you hear? Mubashir, can you hear?
Yes, sir. Yes, sir, we can hear.
The first microlearning content as core procedure that every student must know how to examine the neck for lump. The lump examination and the lymph node examination go hand in hand, but for the convenience.
So I'll move to show you all. So these are the, say, for example, I'm talking about the neck mass different. And this all micro learning content produced, this is 5 to 7 minutes only video, right? Not more than that. Maximum we go 10 minutes, but I confine myself to 5 to 7 minutes. So one learning outcome only, examine the patient with neck lump. Then these are the differential diagnosis given to them, and this are the examination they will do. And then we also add some quizzes. And this during the constraint of the MCO COVID, I didn't have access to patients. even simulated
So
patient. So
normally
my
an
wife, who was
examination
is
of
a
the,
medical
neck lump,
doctor, she
you have to have
volunteered to
a
be my
ENT
patient. So
surgeon
I
right
produced this
hand
video.
I
And you
stay
saw,
with you
I'm
and
talking
my
to
right
her.
hand
In
is
fact,
all
I'm talking to
over there.
the students.
And the
So they
patient
can
sits
watch.
with me with the legs crossed. Then we start examination. So first of all, I would.
Okay, so this is the examination going on, and then students will watch this within 5 to 7 minutes. Video will finish, and then after that there'll be some quiz, right? We add some quizzes, and then they can self-evaluate
Now
themselves.
summarizing,
Okay,
after having sanitized my hands, I introduce myself.
okay. Now going to for example, another. So similarly, these videos are, say, examination of the neck lump and the lymph nodes in the neck. And then these are the virtual medical clinic. Now I take you after the session, they are given the link to go and see a patient, virtual patient online. So they will go and these patients are created, virtual medical clinic are created for
Hello,
them.
doctor. Hi, Mr. Kairi. How can I help you? Doctor, I have a swelling on my neck. Select 6 important physical examinations.
Then we have
about
quizzes,
swelling you would like
inserted
to
quizzes
elicit
in
on this
it,
patient.
right? So we
Drag
are
and drop
asking
the
them
correct
to,
answer.
so drag and put here, and then they will know whether this is right or wrong. So this is how, in concern of the time. Mubashir, how much time is I'm left with?
Almost no time, sir.
Okay, done. Okay, so let me finish. So this is that, and then let me go back to the, just show me one more very quick. So, and other, in this link, the next would be, for example, self-assessment. We give self-assessment IRAT individual, and then we ask them to do is at a GRAT. GRAT means they will be doing as a group. So they go on, do it as a group. They will open this link, and then you have to enter. If I start, no, I can't start because I haven't entered the group number. Say I am group number 2, right? So they start. So this will appear. These are 10 OBA, one best answer or MCQA. They will read together as in a group, and the one student who is downloaded this link, he will they will discuss among which one is the right answer out of these 5 scenarios given here. So say, for example, they decide for C, collectively they decide, then the person who has downloaded will hold this and scratch there.
Sorry, maybe next time.
So this is wrong answer, Sai. So similarly, they can.
Sorry, maybe next time.
Okay, so this is how they will do the GRAT, the group assessment, but the same 10 items they would have taken as an IRAT individual, right? But in individual, we do not tell them the answer. It is created in a, so individual is not provided with the right or wrong answer, because if they know, there's no aim of doing it as in a group, okay? So this is how it is done. And finally, we go and do the reflective practice very quickly, and then I finish. This is the last one. So end of the day, we ask them to click the this, and there they have to reflect, right? They will go, they reflect, they put their name, cohort, group, everything. And then this is test of prior knowledge, which I have given another, I didn't show you test of prior knowledge. There is a video, they will have to put how much mark they secured, and then they will go and give their reflection on description. This is the Gibbs model practice here. So they will talk about the event, the session TBL online, and then, everything is done here. So 6 items, and then very quickly, I'll show the result. So this is all I have talked to you already, GRAD and VMC. So this is the result that of the reflection. So they reflected, and it was found high level of agreement reported for all the 6 items asked by 151 respondents. All this while online teaching in a small group we have carried out, but over the months and year, 151 students have responded. to this. So TBL Online has helped to lessen the students' frustration of COVID pandemic and continuing clinical teaching and achieving their learning outcome. So this is the result. And in summary, I would say learning must embrace remote hybrid learning models, integrating technology, even if the COVID era is over. A small portion of your teaching learning experiences should still be online, I recommend. Adapting assessment and enhancing communication, implementing active learning, fostering collaboration, providing support and mentorship, maintaining flexibility is important, facilitating students' engagement and ensuring effective clinical teaching for continuing quality improvement, which you can see, if they have visited the VMC clinic or they have done the GRAT and all, from there you can download and see how many of them actually visiting will tell them about their continuing learning behavior or lifelong learning behavior. Faculty role crucial in navigating these adaptations in the face of ongoing challenges that may happen again in future. With this, I thank you very much, and I'm ready for the question answer session. And I'm also ready for the institution who wants my help to develop all these kind of model, bedside teaching online and task-based learning and all other. I can help them a lot. Okay, so the lesson plan, basically the message is that you have to have a very good lesson plan, and all these links and all I showed is the digitalized lesson plan that we have uploaded on the portal. And using this lesson plan, it's very easy for me. If say I have to conduct this session one after another, I'm always ready. So one-time job, but then I'm ready for online teaching. Over to Mubashir. Thank you very much for your kind listening.
Thank you, sir. Thank you all. If any questions, please unmute yourself and you can ask the questions. And we will also review the chat to see if there are any questions in the chat.
I'm sorry, I went little over time, but having not shown all these components of the task-based learning to design a lesson plan wouldn't have been worth it. So I would have been left to stranded. So that's why I took little more time, but I think it was worth it.
Yes,
Sorry,
Dr. Supriya. Yes, Dr. Supriya Dhumale has asked, is it similar like PBL?
No, as I told you, in PBL is different ball game. In PBL, we have paper patient. Often it's not, though it is good to have authentic or real patient, but we create patient. It's a paper patient, and then a supervisor again is a facilitator role, and then students follow certain steps, right? And those steps are, for example, they start with the patient data, then they clear the terminology, step 2, then they go for the identifying the clinical problem, then step 4 is generating hypothesis, 5 is organizing hypothesis, 6th is the learning issue. So they will identify the learning issues which they couldn't solve in the group, then we have to give them extra time. So identify the learning issues, step 5, step 6 is in PBL, where they will go for self-study, and 7 is that they come back and share their self-study time to solve the problem on. So this is a typical, very comprehensive protocol for the PBL, which is in task-based learning. You can design your own way, but this is how we have designed it. There is a room to, it's a little more flexible, but team-based learning, task-based PBL and case-based learning are very rigid structured model. We can't play in that model. Here we can play a lot. I hope I'm clear.
Thank you, sir. What is AOL? Dr. Shalini has asked.
AOL, what is it?
Dr. Shalini, if you can unmute yourself and ask your question, please.
Where was it?
Sir, it is assurance of learning. Can you highlight about what is assurance of learning?
Pardon, come again.
AOL is assurance of learning.
Assurance of learning.
Yes.
Okay.
Can you?
Yeah, assurance of learning is, as I told you, they are different, particularly online learning. You have a better opportunity to ensure that what you have been delivering has been learned from this by the students or not. There are different way of assurance of learning to be ensured. And for example, you can have a self-assessment, you can have a formative assessment, you can use a model for evaluation of students visiting virtual medical clinic. And if you have this all available, a good portal available or LMS available, students visiting these all will give you an assurance, and you can go back and see if 30 students are attending your session, how many they have visited the virtual medical clinic, and how many of them have taken the group test and individual test, right? So it helps you to achieve the learning outcomes. And if the learning outcomes, so how the student perform in their self-assessment will give you how much they have captured during the session. So this kind of assurances can be achieved through various. One is the summative, but nowadays summative is something which is end of the day we do, but I think more important is to go for the formative assessment or continuous assessment or self-assessment and peer assessment. Now you see metacognitive, under the metacognitive skills, self-assessment and peer assessments are taking a higher role in formative assessment. So adopt all these methods to ensure that what you have taught students have actually achieved the learning outcome you have set. So AOL always is guided through a learning outcome, and then you have your own means to see how these learning outcomes has been achieved.
Thank you, sir. Another question by Dr. Gizma, that TBL is only for clinical teaching or can be used in teaching of basic medical sciences like anatomy or physiology?
You mean this task-based learning or PBL?
Task-based learning. Task-based.
Okay, task-based learning is more for the clinical education. If you want to do for the basic sciences or basic medical sciences, then you should go for the team-based learning, which gives you more options. But task-based learning, though you can, you know, none of the curriculum these days is 2 phases isolated from each other. They are integrated. We are teaching a curriculum with the integrated phase. So students have early clinical immersion. They go to the clinics early in their phase 1, year 1, or semester 1 or semester 2. But keeping the level of their training, you can always develop the task-based learning with more input on basic sciences than on the clinical. So as you go advanced in training, you can modify it, but to me is best suitable tool for the clinical education. And if you want to do for the basic sciences, then you should use the team-based learning.
Thank you, sir. Dr. Mona Abul Saud, she wanted your email address. I will share that with her.
Okay.
And another question is, can we have a small note on the presentation for us to reflect on?
A small note for?
On the presentation to reflect on.
So I mean, I have given the presentation, so you guys can reflect on. Are you asking me to reflect?
If Dr. Faluj Abudola, if you can ask the question, unmute yourself.
Can you ask the question? Unmute yourself and ask. Because reflection should come from you guys. Yes. Amir is raising hand. So if at all you want my reflection after this presentation, so my message is that continue doing some components of your curriculum delivery online. And for example, you are teaching bedside teaching, all face-to-face, you know, other methods of teaching, word round and all are doing face-to-face. Why not go for team-based learning online, right? And have more, you see, you have a more comprehensive reporting on a student's learning. AOL, as for example, I was asked, gives you a better TBL online gives you a better opportunity. Besides, keeping your students and your faculty ready for any unlikely situation that may happen, like we had the COVID for such a long 2.5 years. I think Amir Ali Khan is raising hand. Mubashir?
Yeah, Dr. Amir, yes. Can unmute yourself and ask a question.
Dr. Mubashir, there are so many questions on the chat box.
Yes, sir, I'm reading those questions.
Okay.
So thank you. And Dr. Adnan Ali has invited
Don't
us
worry.
to attend the IMI's conference in New Zealand. We'll certainly join. Then Dr. Mona Abul Saud has asked for, can you please highlight the difference between learning outcomes and learning objectives?
Okay, good. So learning objective is both has to start with an action verb, and the action verb should be measurable, but not as much in learning outcome as for the learning objective. Learning objective is that the teacher is given an objective, gives an objective to the students, or he develop an objective for himself to deliver a lecture, a formal lecture, interactive, whatever the session would be. It is the learning of gauged by learning objective, meaning that what students need to learn. But whether students have really learned it or not, learning objective may not tell you, but learning outcome will tell you. For example, you have 5 learning outcome in your session or your topic, but I suggest you, when you go for the topic, for the course, you may have 5 learning outcomes. So for topic, choose 2 or 3 learning outcomes. So keep yourself to that learning outcome. So students are very guided and they have a very structured program for your topic delivery, whereby they know that after attending this session, if it is a task-based, for example, you are teaching them on some procedure, so students should know that after attending this session, they should be able to examine the patient with a neck lump. They should be able to examine the lymph nodes in the lung, in the neck, right? So say, for example, these 2 learning outcomes. So these are the measurable learning outcomes. Now, how do you measure? You do a self-assessment, a peer assessment, an evaluation in using virtual medical clinic, whatever the scores are provided. From the score, you will be able to gauge at, obtain a result on a student's performance. So now I repeat, learning objective is the objective whereby you develop your topic to be delivered, irrespective whether students really learn it or not, is learning objective. But it has to be with an action verb also. It must be written with an action verb. But learning outcome is the one where you ensure that this, after attending your session, the student should be able to perform certain tasks that you are in your topic is delivered. And to achieve that, then you develop your topic in a way where students find it feasible to be able to perform that things, right? That skills or whatever the knowledge base. And then when you assess them with the score or the result, for example, I tell you this is a constructive alignment. Based on the learning outcome, I will see whether I have achieved the learning outcome or not. So say I have teaching them a neck mass. Then I do an assessment. I assume that considering my class, I know that at least 80% the student should pass this self-assessment or virtual medical clinic evaluation, right? 80% students. So 80%, if I go online and see their result, if 80% have passed, I have achieved the learning outcome. If not, then I have not achieved, then I have to look back, what was wrong with my teaching learning method and why misconceptions happened? Was my assessment was not aligned with what I taught? So these all give you feedback. So learning outcome, based on learning outcome, actually you can have a constructive alignment of the entire curriculum. I hope I'm clear.
Thank you, sir.
Yes, sir. Thank you very much.
If I may ask Dr. Muhammad Abdul Zahra, if you can unmute yourself and ask your question, please.
Thank you very much for this nice comprehensive presentations. May I ask you, did you use this task-based learning nowadays? And if you use it, did you use it at the beginning of the course, at the middle, or the end of the course?
Okay, we use this after we invented this. I think Hassan was part of this, because we initially we went for this innovative idea for the what you call bedside teaching. Then having encouraged to design and develop and practice bedside teaching, we moved on to apply the same, the Gainey's 9 steps events, gives, calls, and all this other theoretical model, hypothetical deductive and all. So we applied this to develop the task-based learning. So I think it was developed 6 months after the COVID, and we practiced this throughout the COVID and until now. But very recently, my institution has asked us that every session has to be 100% face-to-face on campus. But I tell you, if my discretion goes, if my decision goes, I will say task-based learning among all the clinical education that we had, task-based learning can still be done online. So until now, we have been doing it. I think I'm back from my leave, and I heard that now the teaching has to be on campus, right? But we practice this almost over 3 years and very successfully.
So I did something like that, whether it is task-based or not. What did during COVID, I present as a patient, and myself present as patient with anemia, shortness of breath, palpitation, dizziness, etc., and ask one of the students to take history from me. And then at the end of the history taking, I ask the groups to feedback him what he missed, what better in the future he will be. Okay. And then after that, I ask him to do somebody else to do an examination, to examine me. So virtually, they don't find, but I prepare finding. If there is big spleen, I told them there is big spleen or liver or jaundice or pallor or something like that. Then every time I ask them that what are your differential diagnoses? And then after the finding, physical finding, then what are your differential diagnoses? Then after that, definitely it will become narrower. And then I ask them what investigation you are going to send. If they ask chest X-ray, I will show them a normal chest X-ray if it is normal, ultrasound or blood investigation, blood biochemistry, and then at the end I will show them the real case. Maybe at the end of the session will be a case of celiac disease. But at the end, a student, they don't. It's simple. I think. What is your idea about? Is it task-based or not?
First of all, this is very much task-based learning, right? Because as I said, there is no. There's no very defined or structured model for task-based learning. So when I had to do a workshop, in the first session of the workshop, I asked the 12 disciplines attending this workshop, 12 department representative, I asked them, how do you deliver task-based learning? So 2 or 3 of them were doing exactly the way you told them just now. So this is also task-based learning. But mind you, if you do it, how often will you offer yourself or volunteer yourself to do that, right? Because task-based learning is in a routine. Every week we have to do one task-based learning. So it is not easy to volunteer your own self every time for this, and few faculty was doing that. So after that, we developed this design. We designed this and we developed it to practice, and everybody now follows. So this is a very feasible method where students, and this student will be, if there are 30 students, as they go on 12 theme, for example, in ENT, we have, we think 8 to 10 themes there. So 10 students will be needed, and I cannot volunteer myself 10 times to be, giving history and all. So this is a better structure, better protocol. But what you have been doing is very close to the task-based learning.
But the feedback of the student was not so good. Why? Do you have the same feedback, or your student?
I gave you the feedback. I gave you the feedback as a result at the end. Right, I showed you the result was very encouraging, right? Because there are a lot of things which were provided to them online. I said for any teaching online, you must provide 20 to 30% of your learning materials online. What is lacking in your doing this task-based learning your way is that you're not testing them with the prior knowledge, you're not provided them the relevant videos, 5-7 minutes micro learning contents to watch, you're not letting them go through the self-assessment and peer assessment. So these all put together, the students will be motivated, they will be engaged, right? So I think in your model, you are lacking students' engagement, and every time you present yourself, and then when you ask the student to do role play for the patient, I tell you, some students have role played in a way that we chose them for the simulated patient, for the other classes. They did it so well, they acted so well. So even the hoarseness and all this, the various things, the typical voices, hoarseness and all they produce. So they did it very well. But I can't imagine that a supervisor will be volunteering themselves every time. So you may be exhausted, you may be fatigued, and so are the students.
Yes, and Mr.
Thank you very
Hasnan
much.
Zafar added that you need to add gamification in it.
Yeah,
So
that's right. That's right. Gamification is something which attracts students, learning as well as, playful learning.
Exactly, sir. So there is another question
Yeah.
if you have, sir. What is the difference between SDL and TBL?
Between
SDL
and
TBL.
so TBL is team-based learning. SDL, I assume, is self-directed learning.
Exactly, sir.
These are two different things. SDL is not a teaching learning model, right? It's an approach. Self-directed learning is an approach, but under self-directed learning, you can give student tasks, you can give anything to do, but it's not a teaching learning model, rather it is an approach. And team-based learning or the task-based learning are authentic teaching learning models.
Yes, and Dr. Muna Abdul Saud has added that you can also use virtual patients in task-based learning.
Correct. You can use virtual patient in task-based learning. Very much right.
Thank you, sir. That ends.
But try to use authentic patient, real patient scenario rather than virtual. Because in PBL we use a lot of virtual or paper patient. But I recommend that in task-based learning, use the real patient. Real patient scenario, I mean, not the patient. Okay.
Wonderful, sir.